In the cobblestone streets of Prague's Old Town, where the Gothic spires of St. Vitus Cathedral cast long shadows over medieval alleyways, a bookbinder named František Novák lived 43 years with a secret hidden so deep within his body that even he was unaware of its existence. On a fog-shrouded evening in October 1887, a robber's knife would pierce the right side of his chest and reveal one of medicine's most extraordinary anatomical mysteries. František's entire internal anatomy was a perfect mirror image of normal human structure. His heart beating on the right side of his chest, his liver positioned on the left, every organ reversed in a condition so rare that it challenged everything physicians understood about human development. The discovery would raise profound questions, not just about anatomy, but about consciousness itself, whether František's reversed brain had caused him to experience reality in ways that no normal person could comprehend. His perception of left and right, space and direction, fundamentally inverted from birth in a neurological mirror world that died with him. The Prague of 1887 was a city caught between worlds, the ancient capital of Bohemia, struggling to maintain its Czech identity within the vast Austro-Hungarian Empire, while embracing the Industrial Revolution that was transforming Central Europe. The city's skyline was dominated by the imposing Hradčany Castle, seat of Habsburg power, while below, in the winding streets of Malá Strana and Staré Město, Czech artisans and merchants carried on traditions that stretched back centuries. The Vltava River divided the city both geographically and culturally, with the German-speaking administrative elite concentrated on one side and the Czech-speaking majority on the other. This linguistic and cultural divide permeated every aspect of Prague life, from the newspapers people read to the schools their children attended, creating a complex social fabric that would profoundly influence the medical investigation of František's case. The Old Town, where František lived and worked, was a maze of narrow streets and hidden courtyards that had changed little since medieval times. The area was dominated by artisan workshops, small businesses, and the homes of the Czech middle class, who had managed to prosper despite the political and economic pressures of imperial rule. The smell of leather, ink, and glue from bookbinding shops, mixed with the aromas of bread from bakeries and the smoke from countless coal stoves that heated the ancient buildings. Prague's medical community was centered around the Charles University Medical Faculty, one of Europe's oldest and most prestigious institutions, founded in 1348. The university's anatomical theater, with its steep wooden benches surrounding a central dissection table, had witnessed centuries of medical discovery and debate. The faculty attracted students and researchers from across the empire, creating an intellectual environment where Czech, German, and Austrian physicians worked together despite the political tensions that divided their communities. The medical school's pathology museum housed one of Europe's finest collections of anatomical specimens, including rare developmental abnormalities and unusual cases that had been preserved for teaching and research purposes. The museum's curator, Professor Karel Rokitansky, was internationally renowned for his work on pathological anatomy and had established Prague as a center for the study of congenital anomalies and developmental disorders. Dr. Antonín Heverok, the surgeon who would discover František's extraordinary condition, represented the new generation of Czech physicians who were determined to establish their medical credentials within the German-dominated academic hierarchy. Born in 1851 in the small Bohemian town of Tábor, Heverok had fought for the right to conduct his medical education in Czech rather than German, becoming part of a movement that sought to create a distinctly Czech medical tradition within the broader framework of European science. Heverok had trained in Vienna under some of the empire's most distinguished surgeons, including Professor Theodor Billroth, who had pioneered new techniques in abdominal surgery. However, he had returned to Prague with a mission to serve his own people and to contribute to the growing body of medical knowledge being generated by Czech physicians. His practice combined the latest surgical techniques with a deep understanding of the social and cultural factors that influenced health and disease in Bohemian society. The surgeon's reputation was built on his meticulous attention to detail and his willingness to take on challenging cases that other physicians might avoid. He was known for his innovative surgical approaches and his ability to adapt standard techniques to unusual circumstances, skills that would prove crucial when he encountered František's reversed anatomy. František Novak embodied the quiet dignity of Prague's artisan class, men who had learned their trades through generations of family tradition and who took pride in the quality of their craftsmanship. Born in 1844 in a small apartment above his father's bookbinding shop on Nerudova Street, František had grown up surrounded by the tools and materials of his trade: leather, glue, thread, and the distinctive smell of bookbinding that would define his working life. The Novak family had been bookbinders for over a century, serving Prague's intellectual community by creating and repairing the volumes that filled the libraries of scholars, priests, and wealthy merchants. František's father, Joseph, was known throughout the city for his ability to restore damaged manuscripts and to create beautiful leather bindings that were works of art in their own right. The bookbinding trade required exceptional skill and patience, as each volume had to be carefully disassembled, repaired, and reassembled using techniques that had been passed down through generations. The work involved sewing signatures together with linen thread, applying glue made from animal hides, and creating decorative covers using gold leaf and intricate tooling patterns. František had shown an aptitude for the trade from childhood, displaying the patience and attention to detail that were essential for quality bookbinding. His small hands were perfectly suited for the delicate work of sewing signatures and applying gold leaf, while his artistic eye allowed him to create decorative patterns that enhanced the beauty of the books he bound. However, there were subtle signs throughout František's childhood that suggested something unusual about his development, though these signs were so minor that they were attributed to individual quirks rather than underlying anatomical differences. He was left-handed in a family of right-handed craftsmen, requiring his father to modify traditional techniques to accommodate his son's preference. More puzzling was František's apparent difficulty with certain spatial tasks that seemed inconsistent with his obvious intelligence and manual dexterity. When learning to read, František had shown a tendency to reverse letters and words in ways that persisted longer than was typical for children. He would write his name as Chitnar F and seemed genuinely confused when corrected, as if the reversed version appeared more natural to him. His teachers at the local parish school attributed this to stubbornness or poor instruction, never suspecting that his brain might be processing spatial information in fundamentally different ways. They would force him to practice writing his letters correctly, sometimes tying his left hand behind his back to encourage him to use his right hand. But these interventions only seemed to increase his confusion and frustration. František's navigation of Prague's complex street layout also showed peculiarities that his family noticed but never fully understood. He would consistently give directions that were the mirror image of correct routes, telling people to turn left when they should turn right. Yet he himself never seemed to get lost. It was as if he possessed an internal map of the city that was accurate but inverted, allowing him to navigate successfully while confusing anyone who tried to follow his directions. When František began working in his father's shop as an apprentice, these spatial peculiarities manifested in interesting ways. He would approach bookbinding tasks from unusual angles, working from right to left instead of left to right, and organizing his tools in patterns that seemed backwards to other craftsmen. Yet his finished work was consistently excellent, suggesting that his different approach was not a handicap, but simply an alternative way of organizing and executing complex tasks. Despite these quirks, František had grown into a skilled and respected craftsman who had inherited his father's shop and built a loyal clientele among Prague's book collectors and scholars. His workshop, located in a narrow building that had housed bookbinders for over 2 centuries, was filled with the tools and materials of his trade, carefully organized according to his own unique system. František's customers included professors from Charles University, priests from the city's many churches, and wealthy collectors who appreciated the quality of his work. He specialized in restoring ancient manuscripts and creating custom bindings for rare books, work that required not only technical skill, but also a deep understanding of historical bookbinding techniques. He had married Anna Svoboda, the daughter of a printer, in 1870, and together they had raised 3 children while maintaining the family business that had served the community for generations. Anna had learned to assist with some aspects of the bookbinding work, particularly the decorative elements that required artistic skill, and she had developed her own theories about her husband's unusual working methods. Anna had noticed that František seemed to see patterns and relationships that others missed, as if his different way of processing spatial information gave him insights that were unavailable to people with normal brain organization. She would often watch him work on complex restoration projects, marveling at his ability to understand the structure of damaged books and to devise innovative solutions for repairing them. The couple's children, Joseph, Marie, and Carol, had inherited some of their father's unusual characteristics, though none to the same degree. Joseph was left-handed like his father and showed some of the same spatial reasoning abilities, while Marie had an exceptional ability to visualize complex 3-dimensional relationships that made her particularly skilled at the decorative aspects of bookbinding. František's health had always been robust, with no significant illnesses or injuries that might have revealed his unusual anatomy. He had never required surgery or extensive medical examination, and the few times he had consulted physicians for minor ailments, the examinations had been superficial enough that his reversed anatomy went undetected. The only hint of his condition might have been found in the positioning of his heartbeat, which could be felt most strongly on the right side of his chest rather than the left. However, in an era when physical examination techniques were still primitive, and when many people never received thorough medical evaluations, this anomaly had never been noticed or investigated. František's family physician, Dr. Václav Šebek, had treated the bookbinder for various minor ailments over the years, colds, digestive upsets, and the occasional injury from his work, but had never had occasion to conduct a thorough physical examination. The doctor's notes from these visits, preserved in his medical records, show no indication that he suspected any anatomical abnormalities. The events that would lead to the discovery of František's extraordinary anatomy began on the evening of October 23rd, 1887, when he was walking home from his shop through the narrow streets of Prague's old town. The autumn fog that frequently shrouded the city had descended early that evening, creating an atmosphere of mystery and danger that made the medieval alleyways seem even more labyrinthine and threatening than usual. František had spent the day working on a particularly challenging restoration project, a 15th-century illuminated manuscript that had been damaged by water and required extensive repair work. The project had demanded his complete attention for several hours, and he was tired but satisfied with the progress he had made. The manuscript, a religious text with beautiful hand-painted illustrations, represented the kind of work that made his profession meaningful to him. As was his custom, František was carrying the day's earnings in a leather pouch, planning to deposit the money in the bank the following morning. The route from his shop to his home normally took him through some of Prague's busiest commercial streets, but the fog had emptied the thoroughfares of all but the most determined pedestrians, creating an eerie silence that was broken only by the sound of his footsteps on the wet cobblestones. The fog that evening was particularly thick, reducing visibility to just a few feet and muffling sounds in ways that made the familiar streets seem foreign and threatening. Gas lamps flickered weakly through the mist, creating pools of yellow light that only emphasized the darkness beyond their reach. The usual sounds of the city, the clip-clop of horses' hooves, the rumble of cart wheels, the voices of pedestrians, were all but absent, replaced by an unnatural quiet that made every footstep seem unnaturally loud. As František turned into a narrow alley that served as a shortcut to his neighborhood, he was confronted by two men who had been waiting in the shadows near a tavern that catered to the city's criminal element. The robbers, emboldened by the fog and the apparent isolation of their target, demanded that František hand over his money and valuables. The two men were typical of the petty criminals who preyed on Prague's working class. Unemployed laborers who had turned to crime out of desperation, their faces bearing the marks of poverty and hard living. They had been drinking in the tavern for several hours, building up their courage for the robbery they had planned when they noticed František's regular evening routine. František, who had lived through the political upheavals and economic uncertainties of 19th-century Bohemia, was not easily intimidated. He had survived the revolutions of 1848, when Prague had been torn apart by nationalist uprisings and Austrian military repression. He had weathered the Austro-Prussian War of 1866, which had brought foreign armies to Bohemian soil, and the various economic crises that had periodically swept through the empire. His response to the robbers' demands was to clutch his money pouch more tightly and attempt to push past them toward the safety of the main street. František was a small man, but he was wiry and strong from years of physical labor, and he was not inclined to surrender his hard-earned money without a fight. The confrontation that followed was brief but violent. One of the robbers, frustrated by František's resistance and perhaps influenced by alcohol, drew a knife and lunged at the bookbinder. The weapon was a common type, carried by working men. A folding knife with a 4-inch blade that was used for various tasks but could serve as a weapon when necessary. In the struggle that ensued, the blade penetrated František's chest on the right side, just below the collarbone, in what should have been a survivable wound to the lung or chest wall. The knife entered at an angle that would normally have missed the heart and major blood vessels, causing injury that, while serious, would not typically be immediately life-threatening. Instead, František immediately collapsed, his face turning blue as he gasped for breath and clutched at his chest. The reaction was so sudden and severe that it shocked even his attackers, who had not intended to inflict a fatal wound. The robbers, terrified by the severity of their victim's reaction to what they had intended as a threatening gesture rather than a fatal attack, fled into the fog, leaving František bleeding and unconscious on the cobblestones. František was discovered by a night watchman making his rounds approximately 20 minutes after the attack. The watchman, an elderly man named Tomáš Novotný, who had served in this capacity for over a decade, immediately recognized the severity of the situation and summoned help from nearby residents. Several neighbors responded to the watchman's calls, including a local physician, Dr. František Kafka, no relation to the future writer, who lived nearby and was known for his willingness to treat emergency cases. Dr. Kafka's preliminary examination revealed a patient in severe shock, with obvious signs of cardiac distress that seemed disproportionate to the apparent severity of his wound. The decision was made to transport František to the General Hospital of Prague, where more advanced medical care would be available. The journey through the fog-shrouded streets was difficult and time-consuming, as the bearers had to navigate carefully through the narrow alleyways while trying to keep their patient stable. František was brought to the hospital's emergency receiving area, where Dr. Heverok was serving as the duty surgeon for emergency cases. The surgeon's initial examination revealed a patient in severe shock with obvious signs of cardiac distress. The wound on the right side of his chest was bleeding, but did not appear to be immediately life-threatening, leading the surgeon to suspect that the knife might have caused internal injuries that were not immediately visible. The patient's pulse was weak and irregular. His breathing was labored, and his skin had taken on the bluish tinge that indicated inadequate oxygenation of the blood. These symptoms suggested either severe lung injury or, more ominously, damage to the heart or major blood vessels that required immediate surgical intervention. Dr. Heverock's experience with chest wounds had taught him that external appearances could be deceiving and that seemingly minor injuries could sometimes cause catastrophic internal damage. He had treated soldiers during the recent conflicts in the Balkans and had learned to be suspicious of any chest wound that caused immediate cardiovascular collapse. The surgeon made the decision to operate immediately, recognizing that František's condition was deteriorating rapidly and that conservative treatment was unlikely to be effective. He assembled his surgical team, including his assistant Dr. Emil Kratochvil and the hospital's most experienced surgical nurse, Sister Božena, a nun who had dedicated her life to caring for the sick and injured. The operation began in the hospital's main surgical theater, a gas-lit room where the most challenging cases were treated. The theater was equipped with the latest surgical instruments and featured an observation gallery where medical students could watch procedures and learn from experienced surgeons. František was placed under anesthesia using chloroform, administered by Dr. Kratochvil, using the latest techniques that had been developed to ensure patient safety during surgery. The anesthesia process was carefully monitored, as chloroform could be dangerous if not properly administered, particularly in patients who were already in shock. Dr. Heverock made a long incision along the left side of František's chest to gain access to the heart and lungs, following the standard surgical approach that had been taught in medical schools for decades. The surgeon expected to find the heart in its normal position on the left side of the chest, where he could assess and repair whatever damage the knife had caused. However, when the surgeon opened František's chest cavity, he found himself staring at anatomical structures that seemed to defy everything he had learned about human anatomy. Where he expected to find the heart, there was only lung tissue. Where the major blood vessels should have been positioned, there were empty spaces that suggested the organs he was seeking were located elsewhere. Confused and increasingly concerned about his patient's deteriorating condition, Dr. Heverock extended his incision and began a more systematic exploration of František's chest cavity. What he discovered challenged his understanding of human development and anatomy in ways that would haunt him for the rest of his career. František's heart was located on the right side of his chest, positioned as a perfect mirror image of its normal location. The organ itself appeared to be healthy and normally formed, but its placement meant that the robber's knife had penetrated directly into the cardiac muscle, causing the immediate collapse that had brought František to the hospital. The discovery was so unexpected that Dr. Heverock initially doubted his own observations. He called for additional lighting and asked Dr. Kratochvil to confirm what he was seeing. The assistant surgeon's examination confirmed that they were indeed looking at a heart that was positioned on the right side of the chest, beating weakly but still functioning despite the penetrating wound. As Dr. Heverock continued his examination, he realized that František's entire thoracic anatomy was reversed. His liver, normally positioned on the right side of the abdomen, was located on the left. His stomach, typically found on the left side, was positioned on the right. Even his intestines were coiled in the opposite direction from normal, creating a complete mirror image of standard human anatomy. The surgeon's attempts to repair the damage to František's heart were hampered by the unfamiliar positioning of the organs and blood vessels. The surgical techniques he had learned were based on normal anatomy, and the reversed positioning of František's cardiovascular system required him to work essentially blind, trying to adapt standard procedures to an anatomical configuration he had never encountered. The knife wound had penetrated the right ventricle of František's heart, creating a laceration that was bleeding into the pericardial sac and compromising the heart's ability to pump blood effectively. In a normal patient, this injury would have been approached from the left side of the chest, but František's reversed anatomy required Dr. Heverok to work from an unfamiliar angle. Despite the surgeon's best efforts to repair the cardiac damage, František's condition continued to deteriorate throughout the surgery. The delay in recognizing the true nature of his anatomy had cost precious time that might have been used to repair the injury more effectively. The blood loss from the cardiac wound, combined with the shock of the initial trauma, had pushed František's cardiovascular system beyond its ability to recover. František died on the operating table at 3:47 a.m. on October 24, 1887, approximately 6 hours after the attack that had revealed his extraordinary secret. His death was attributed to cardiac tamponade and exsanguination, resulting from the penetrating wound to his reversed heart. Though the underlying anatomical condition that had made the injury fatal remained a mystery that would require extensive investigation. The autopsy performed the following day by Dr. Heverok and his colleagues revealed the full extent of František's anatomical reversal. Every organ in his body was positioned as a mirror image of normal anatomy, a condition known as situs inversus totalis that occurs in fewer than 1 in 10,000 births. The pathological examination was conducted with meticulous care, as Dr. Heverok recognized that he was documenting a case of extraordinary medical significance. Each organ was carefully examined, measured, and photographed to create a complete record of František's unique anatomy. The examination showed that František's organs were not only reversed in position, but were also perfectly functional in their mirrored locations. His heart had 4 normal chambers with properly functioning valves, though the usual asymmetries that characterize cardiac anatomy were reversed. His liver had processed toxins and produced bile normally throughout his life, despite being positioned on the left side of his abdomen. František's digestive system had operated efficiently despite its reversed configuration, with his stomach, pancreas, and intestines all functioning normally in their mirror image positions. The blood vessels that supplied these organs had developed in patterns that perfectly supported their reversed anatomy, creating a complete and functional circulatory system that was simply the mirror image of normal. Most remarkably, the autopsy revealed that František's brain also showed subtle but significant differences from normal anatomy. The usual asymmetries that characterize the human brain were reversed, with the left hemisphere showing characteristics typically associated with the right hemisphere and vice versa. The brain's language centers, normally located in the left hemisphere, appeared to be positioned in the right hemisphere, while the spatial processing areas typically found in the right hemisphere were located on the left. This finding suggested that František's neurological development had followed the same mirror image pattern as his other organs. Dr. Heverok's detailed anatomical drawings of František's body became some of the most important medical illustrations of the 19th century, providing the first comprehensive documentation of complete situs inversus in an adult who had lived a normal lifespan. The drawings showed not only the reversed positioning of the organs, but also the complex adaptations that had allowed František's cardiovascular and digestive systems to function normally despite their unusual configuration. The case attracted immediate attention from the international medical community, with physicians from across Europe traveling to Prague to examine František's preserved organs and to study Dr. Heverok's findings. Professor Rudolf Virchow, the famous German pathologist, made a special trip from Berlin to examine the specimens and declared them to be among the most remarkable examples of developmental variation he had ever encountered. The case was presented at medical conferences in Vienna, Berlin, and Paris, where it generated intense debate about the mechanisms of embryonic development and the factors that determine organ positioning during fetal growth. The discovery challenged existing theories about how the body's left-right asymmetry is established during development and opened new avenues of research into the genetic and molecular factors that control organ positioning. The discovery of František's condition also raised profound questions about the relationship between anatomy and consciousness that went far beyond purely medical considerations. If his brain was indeed a mirror image of normal structure, how had this affected his perception of the world? Had he experienced left and right, spatial relationships, and even abstract concepts in ways that were fundamentally different from normal people? Dr. Hivrock became fascinated by these questions and began to investigate František's life history, interviewing his family, friends, and customers to learn more about any unusual behaviors or perceptions that might have been related to his reversed anatomy. The surgeon's research revealed the subtle signs that had been present throughout František's life: his left-handedness, his tendency to reverse letters and directions, his unusual spatial reasoning, all of which took on new significance in light of his anatomical condition. František Novak's legacy extends beyond his medical significance to encompass broader questions about human diversity, adaptation, and the hidden variations that exist within our species. His story reminds us that what we consider normal anatomy is just one possible configuration of the human body, and that nature is capable of creating functional alternatives that challenge our understanding of biological rules. The bookbinder, who lived 43 years with his organs in reverse, teaches us that the human body is more adaptable and variable than we might imagine, and that consciousness itself might be more flexible and diverse than our limited perspective allows us to perceive. His case stands as a testament to the hidden complexity of human biology and the profound mysteries that can be concealed within even the most ordinary-seeming lives.